My name is Toke.ayeni. I'm a student of the Kaiser University. I'm here to make a presentation on the biopsychosocial reviews on smoking. First is an overview on smoking. Funk and Wagnerlis defined smoking as an inhalation or exhalation of fumes of burning tobacco. The scholars asserted that smoking was not initially viewed as dangerous or harmful until the 70s. Clinical researchers revealed that smoking was the major cause of diseases such as lung cancer, cataract, bronchitis, coronary arteries, complications, post-surgery wound infections. A quick look at the Diagnostic and Statistics Manual of Mental Disorders, 2013, 5th edition, classified tobacco as a substance that is related to an addictive disorder. Its excess usage when it activates the brain, it enhances the brain reward system and deals with reinforcement of behaviors and production of memories. More so, when it is abused, it assumes a pathological pattern. The individual becomes aware of dangerous effects of the substance, yet has to depend on greater amounts of the same substance to get desired results. Such individuals are faced with the failures of daily obligations and daily routines in social, personal, and occupational family functions. The individual is unable to function normally without daily obligations and daily routines in social, personal, and occupational family functions. The DSM-5 also identifies the fact that the individual cannot achieve withdrawal from the substance and usually depends on an assistance for withdrawal. This paper presents a sequence of reviews of previous and current authors in the biopsychosocial factors for smoking. It also highlights how biological, psychological, and social factors contribute to the development of smoking. More so, it evaluates the previously done smoking cessation programs as well as intervention methods. It also looks at how effective such interventions are in the correction of social problems. One of the recently done reviews was by Oliver, Lubman, and Frester, 2007. The authors highlight on the biopsychosocial-review to smoking. They reported an increase in the trend among psychiatric patients. They pointed out the fact that the percentage of smoking prevalence among patients with depressive and anxiety disorders are from 70 to 90. A biological explanation given for the occurrence of this phenomenon was that nicotine contains 4,000 chemical compounds which activates the brain cells on contact, stimulating the release of dopamine. This can cause the brain to malfunction, leading to mental disorder. Secondly, a psychological explanation for this has to do with the psychiatric patients who are diagnosed of mental diseases such as schizophrenia. This type of category of patients are unable to cope with the daily challenge of the mental condition, and so they depend on substances such as tobacco to escape from the daily symptoms of the mental condition. The authors also identified that the cigarette smoking is being used as reinforcement for medical compliance or for control of behaviors, so patients would not feel that they are being restricted or caged within the rehabilitation institutions. This could amount for why more of the patients diagnosed of psychiatric disorders take to the use of tobacco smoking on a consistent basis. A quick look at the information provided by Oliver Lubman and Frestel. It is obvious that the larger percentage of smoking behaviors is accounted for by clinicians' method of correction in the institution. There would be a need to re-educate such workers on the hazards of wrong methods of reinforcement. They should be enlightened on the disadvantages of using cigarette as a major reinforcement. They should learn about healthier strategies to reduce the possibility of quitting. Next is a similar assertion by Oliveira et al. In an empirical study which highlighted on the fact that tobacco smoking was responsible for the majority of deaths in a lot of cases, as well as certain diseases that are cardiorespiratory in nature. This study was based on the following pieces of information. According to the Brazilian International Scientific Literature, number of patients with psychiatric disorders, tobacco dependence is on the increase. We have a figure right here of 1,812. The individuals with mental disorder depend on tobacco use for benefits such as social interaction needs, alleviation of stress, and solitude. The others aimed by investigating the social demographic and clinical factors associated with the degree of tobacco dependence in individuals with mental disorders, hospitalized in the hospital wards. In order to do this, about 96% patients who were mentally retarded were randomly selected for a 43-minute interview, while the tobacco dependence level was assessed with adequate instruments. Variables were measured and a statistical analysis was performed. A statistical analysis was performed. Now, the following is the result of a statistical analysis. A bivariate analysis was conducted, and from the bivariate analysis, it was discovered that tobacco dependence of inpatients tripled the patients that do not have that had not been admitted in the hospital. This was further confirmed by the linear regression analysis. Although the authors were able to prove their concepts based on the results from the statistical analysis, they do not have reliable framework as a background for their study. In addition, the sample size is too small to be relied upon. That means the magnitude of the independent variable on the dependent variable cannot be dependent on. However, this has left a direction for further researchers who would need to work on the design of the psychometric properties. Next is a similar review made by Hughes et al. This was an attempt to investigate the possibility of smoking among psychiatric patients. This study was based on the fact that previous studies indicated high prevalence of smoking among patients. In order to do this, the authors recruited about 277 patients in a general hospital ward in Minnesota, and they also had a control sample population of 144,000 Minnesotans and 17,000 US citizens between the years 1980 and 1981. However, a cheat test was done to compare the results for both groups. Results indicated that the larger percentage of psychiatric patients were found with smoking habits, much in larger percentage when compared to the control population. This is a commendable effort from the authors. It gave them an opportunity to be able to compare with inpatients and outpatients. However, this cannot be reliable because of the population characteristics. It cannot be generalizable, and there is no way to decide whether the same results will be achieved with other ethnicities. However, this points a direction for future researchers. Next is the set of review on psychosocial factors that could be responsible for smoking. One of these was done by Annevoli and Mederiggers to investigate the level of social network and biological influences. This is to assert that environmental factors, cultural factors, and social factors could be responsible for the behavior of an individual. These results were assessed using personality traits, measurements, and different survey instruments. Results were obtained using the univariate, multivariate, and linear regression analysis, which was computed from the data obtained from the questionnaires given to the participants. Results indicated that siblings and peers had more predictive power on the adolescents than the parents. Although the authors were able to come out with positive outcomes, a better research design will be able to indicate how the psychosocial factors could predict the dependent variable. We also need to know the level of collinearity within the variables to avoid erroneous decisions. We have a couple of other reviews that has been done. One of it was by Liu et al. To investigate the factors responsible for smoking behaviors among coal miners, which was a similar result. We also have a list of authors that made researches on the effectiveness of intervention methods with smoking cessation. The first was made by Roberts, Kane, and Smith, 2013. These authors asserted that smoking behavior is a learned behavior and needs